Take over the session. Welcome to you, sir.
Next is about the vidradhi. अथातो विद्रधीनां चिकित्सितं व्याख्यास्यामः यथोवातद्वान्धन्वन्तरिः उक्ताः विद्रहः षड्ये तेषु असाध्यस्तु सर्वजः शेषेषु कामेषु कर्तव्यात्वरितं शोभवत्क्रिया. Now, in all the vidradhi we have discussed already. That's a deep-seated collection of purpose. I don't translate vidradhi as access alone, and that's what we have discussed during the Nidhanasthana. Now, among those six varieties of the vidradhi, Tridoshaja vidradhi is considered as a asadhya. In all other conditions, in the ama avastha, shopavat kriya, as you do the treatment in the shopa, that's the Arepadyaha, Virekantaha, Ekadashopakramaha. In the Shashirupakrama, you have discussed those procedures. So, from starting from Arepa up to the Virechana, these are the protocols which are suggested in case of the ama avastha. Now, the same in Vagbhata, it's very clearly mentioned like Vidravim Sarove Vahamam Shopavat Smupajareta Pratatam Jahre Tratam Pakuyet Vranamat Kriya. The options are initially Shopavat Kriya. If it is not possible, then Raktamokshana, or then once it comes to a level where it becomes separated, then at that stage you have to give for the Vranamat Kriya as you treat any wound as such. Shodhana, Ropana are the protocols of the treatment. Most of the times in the clinical practice, we will get the patients who have already reached the Pakvavastha. So, practically, the situations where you can treat the Amavastha with the labor, etc., such chances are quite few in our clinical practice because most of the patients would come to you only when there is already a Pakvavastha, and hence most of the times these methods, these labors would be looking to be not much useful in the clinical practice. Now, the approach is Vatagna Mulakalkaiso, Grisa Taila Vasayutehi, Sukosno Bhalo Lepa Prajo Vatavidro. स आमूप औदकमांसस्तु काकौल्यादिः सदर्पणः स्वेहम्लसिद्धोलबणः प्रयोज्यश्च उपनाहने वेषवादैः सकृशरैः पयोभिः पायसैस्तदा स्वेदयेत् सततं चापि निर्हरेच्चापि शोणितम् सचेत् एवम् उपक्रान्तः पाकाय अभिमुखो यदि तं पाचयित्वा शस्त्रेण भिन्द्यात् भिन्नं च शोधयेत्. Now, in case of the amavastha, if the patient comes in the early stage, it could be the lepa. For the lepa, Vatagna Dravyas are used with the Grita Tailavasa, and or it could be Anupaudaka Mamsa, the flesh of animals also can be used for the lepa, and or Upanahana for the same protocols as we have discussed in case of the Shashtirupakrama, Alepa, Upanaha, or maybe the Raktamokshana, Svedana and Raktamokshana also are the protocols. With this, it may be possible to reverse the inflammatory pathology and the shopa can be reduced. If it doesn't, then Sachet Evam Vakrantha Pakaya Abhimuko Yadi, if it doesn't get reversed and it results in separation, then Pachana Chikitsa has to be done, and once it has become Pakvavastha, it's the same protocol as in case of the Shashtirupakrama. You have to do the Bhedana, and once the Bhedana is done, Shodhana has to be the followed treatment. For the Shodhana, Panchamulakashayana Prakshandle Ravanotterehi Tailehi Bhadradi Mudaka Sanyuktehi Pratipureta Vairechanikayuktena Trayurtenam Shodhita Prasak Paranyat Siddhena Trayurten Charopayeta. Now, for the Shodhana, you may use Panchamulakashaya or Bhadradi Madhuka Taila or so on, or the Vairechanika, all Vairechana Dravyas with the Trivurta also can be used for the Shodhana, or Ropana for Ropana, Prasak Paranyat Siddhena. Prasak Paranyat is the Trivurta Sneha. It's not Trivurta Sneha. Trivurta Sneha is any three of the Sneha as such. And as we have discussed earlier, in case of Vatali Vidradhi, practically most of the patients who come to you would be presented with the vascular changes there, necrosis of the tissue. That's exactly the features of the Vatali Vidradhi. Krishnaha, Arunova, Parusho, Bhrisham, Atyartha Vedanaha, Chittothana Prabhakashta Vidradhi, Vatasambhavha, as in case of the carbon cycle where there is a necrosis. And in all such conditions, practically when a patient comes to you with this, it's important to rule out immunocompromised status It could be like diabetes, HIV, and so on. So that's systemic pathologies have to be ruled out. And if there are any systemic diseases like diabetes or so on, they need to be treated effectively. And if you have ruled out those, then usually it's a gram-negative organism infection. Chances of the toxemia are quite high, and hence whether the antibiotics are required or not, and selection of the antibiotics also would be based upon the same on the gram-negative sites. Like usually it would be, what I would prefer is gentamicin in such conditions if at all antibiotics are required. And the requirement of the antibiotic is decided by presence or absence of the systemic disorders. Patients who have the other systemic disorders which enhances the risk as such, definitely antibiotics would be necessary, otherwise it becomes a sadhya. Whereas if it is not so, then you can manage even without the antibiotics. But debridement is mandatory. Effective debridement is necessary because of the necrosis. The tissue has become necrosed, and necrosed tissue need to be removed. And the further follow treatment would be Kaishurugulu Gandhakarasanasana and local treatment with dressing, regular dressing. And once it has become clean, then we may use Jatyatela Padropada. This is how I deal with the patients of Vardhavitra. Then in case of the Pittaja Vidradhis, again in the early stages, Paitikam, Chakara, Laja Madukai, Sariva Yutehi, Traishyat Kshira Pisteva, Payasya, Ushira Chandanihi, Pakehi, Shitakashayerva, Shirehi, Ikshurasistra, Jivani Agstevappi, Sejayet, Sharkara Itehi, Trival Haritaki Namcha Tunam Dishat Madhutravam, Jaloko Bihi Haretcha Asraga Pakumcha Apate Buddhiman. In early stages, it has to be labor with the Shita Virya Dravyas, and even the internal administration of the Shita Kashaya with the Ikshurasa, etc. or Jivani Aghrita also can be used for local application as well as the internal administration, or Haritaki Churna also can be given in. And Rakta Mokshana with the Jalokas are suggested in the early stages of the Pitta Javitra. If it is not possible to reverse the inflammation, then in that case it again has to be the same incision and drainage has to be followed. Apatya Buddhiman, Kshiravaksha Kashayana Prakshalya Udakajayana Tilehi Sayasti Mudukai Sakshotaihi Sarpishayutai Ubadishya Pratanuna Vasasa Vestayat Branam Prapondrika Manjistha Maduka Ushira Padmakaihi Saharidrehi Kritam Sarpihi Sakshiram Ranaropanam Kshira Shukla Prizakparni Samanga Rodhichandanihi Negrodhadi Pravareshu Tesham Tokshatava Kritam. For the Shodhana, it has to be Kshira Vaksha Kashayas, like Panchavalkara Kashaya could be one of the best option for the Kshira Vaksha Kashaya, or it could be Tila Udaka. Of course, for practical purposes, Trifala Kashaya can be useful for all such conditions for the cleaning. Then, or it could be for the Shodhana, again Madhuyasti with Grita also can be used. And Manjista, Madhuka, Ushira, such Pitta Shamaka Ushadis can be given internally in the form of either Dhrita or Kshirapaka for the Ranaropana, and the or Kshira Shukla, Pratakparni, etc. Any of the Pitta Shamana Ushadis can be given. The typical clinical presentation would be of a typical abscess, septic focus, where you will have the pus, and that's exactly the description of the Pitta Vidradhi in the Nidana. Pakko Udumbara Sankasha Shavo Jaradahavan, Kripra Uthana Prapakashta Vidradhi Pitta Sambhavaha. Usually it's a gram positive organism, and most of the times there could be some form of hemolytic spread. The patient may have a focus of infection somewhere else, and that also may have resulted in. And usually the risk of toxemia are comparatively lesser. I don't say no risk as such, risk of toxemia are lesser. The effective treatment has to be drainage. Most of the times, if the patient doesn't have any toxemic symptoms, antibiotics are not necessary. If at all the antibiotics are to be selected, they should be from the gram-positive side, like penicillin or amoxicillin, such derivatives which are usually given, if at all necessary. But generally we can manage even without that if the patient is otherwise healthy and there are no toxemic symptoms. Internal administration is Triphala Kukulu or Kamiduga with Gandhakarasayan and Manjistadi. This is what I would prefer. And the local treatment usually Triphala Kwata, and then of course Jatyatilena. See, when we use practically we use Jatyatila and Tripulakwata as a universal, irrespective of the dosha lakshanas. Of course, if we can prepare the different kashayas or the taila for ropana, the shodhana for kashaya for shodhana and taila for ropana based upon the dosha lakshana, of course the results can be much more effective. But because of the practical difficulties, we may depend upon only these issues. Like then, in case of the Kaphaja variety, Naktamanasya Patrani, Tarunani Phalani Ja, Sumanayashta Patrani, Patola, Aristayostara, Dve Haridre, Madhutistam, Madhukam, Tiktarohini, Priyanguhu, Kushamulam, Chanjilasya Pogebava, Manjistha, Chandana, Ushiram, Utpalam, Sarive, Trivatar, Yetesham, Karke Bage, Rita Prastami Pate, Dusta Vrana Prasanam, Nadi Vrana Vishodhanam, सद्यश्चिन्नव्रणानां करञ्जाद्यम् इदं शुभं दुष्टव्रणाश्च ये च केचित् ये च उत्सृष्टक्रियाः व्रणाः नाड्यः गम्भीरिकायाश्च सद्यश्चिन्नाः तथैव च अग्निक्षारकृतश्चैव ये व्रणाः दारुणाः अपि करञ्जाद्येन हविषा प्रशाम्यन्ति न संशयः. One yoga is mentioned which could be generally used for all conditions as Karanjadikrita. With the Karanjadikrita, of course, we have tried in a few of the patients earlier. Some this thesis also is written in the department with the Karanjadikrita, and it's also available. Karanjadikrita also is available. Compared to Jatyadi Tela, what I have observed is with the Karanjadikrita, the smell in the wound would be somewhat more as such compared to Jatyadi, which may become less acceptable. See, in the current situation, patient would prefer that the situation where the smell also would be not very significant. With the Karanjadikrita, the smell would be somewhat more, discharges would be somewhat more. So, otherwise, it heals well, of course. But these are the issues, simple issues. But Karanjadikrita can be used as one of the choices of the treatment in case of all sorts of the vrana. In all sorts of the vrana, in case of the fresh wound as well as in the dushtavrana, Sadhyashchinna as well as Dushtavrana, Nadi Varana, or any of that, it can be used. It's a broad spectrum treatment for the wounds as such, which even irrespective of the doshas, it can be used. Then, Ishtaka, Sikata, Losta, Goshakrata, Tushapamsh, Bihi, Mutrehi, Usnesh, Satram, Svedayat, Shleshma Vidradhim. In case of Kaphaja Vidradhi, in the early stages, it has to be the Svedana has to be done in the beginning. And for the Svedana, it could be any of the warm substances like a heated brick or maybe sand or so on, or even cow dung, heated cow dung could be used. So, local warming is one of the options to break down the consolidated lesion, or induration can be reduced. Then Kashaya Panehi, Wamanehi, Arepehi, Upananehi, Hare Doshan, Abhikshancha Japi, Alabwa, Asraputatevaja, Araguda Kashaya and Apakanja Apate, Dhavayeta. The others would be Omana or local Arepa and Upanahana with Ushtantravya or Raktamaksham with the Alabu are suggested. And once it becomes separated, again the same, it has to be drained. And for the Shodhana, Haridra, Triuta, Shaktu, Tilehi, Madhusamayutehi, Purutva Pranam Samyak Badniyat Kirtilam Meta, Tataha, Kulatika, Danti, Trivarta, Shama, Arkatilvakehi, Kuryat Tailam, Sagomutram, Hitam, Tatrasain, Pitta Vidradhi Sarvaha Kriyaha Niramsheshadaha, Vidradhyoho Kushala Kuryata, Rakta Agantu Nimittehi, Varunabhigana Kwatham, Apakve, Abhyantaratike. Now, in case of the Kaphaja Vidradhi, it is similar issues, Svedana, and then if it is not healing, then the drainage has to be done, and for the Shodhana, Haridra, Trivrta, etc., Kaphagna Aushadhis are used for the Shodhana and Ropana. In all other Raktaja Vidradhi and Agantu Vidradhi, the same protocol of Pitta Vidradhi has to be used. And in case of the Abhyantar Vidradhi, internal accesses like visceral access like conditions, Varunabhigana is suggested. Ushakadi Prativapam Pipet Sukhakaram Naraha Anayoho Vargayoho Siddham Sarpihi Vairachanaja Achira Vidradhim Hanti Pratak Nishevitam. Another general protocol for prevention of all Vidradhis are Ushakadi Prativapa, Ushakadi Ganadravya applied over the area as such, or internal administration also. And the same Ushakadi Ganadravya prepared in the form of Gasta can be given for Virechana. And Yediseva Ganeshtapi Samsiddham Snehasayutam Karyam Asthapanam Kshipram Tathaivapi Anvasanam. The same Ushakadi Ganadravya can be used for Asthapana or Anvasana, also can be used पान आलेपन भोज्येषु मधुशुक्रतुमो अपि वा दत्त आवापो यथा दोषमापो कोम हन्ति विद्रधिं. Madhushikrutruma can be used for internal administration or local application as such. What I have observed practically is regularly if you consume madhushikru leaves with the food, cooked with this food as such, it can prevent all septic complications. Septic complications can be effectively prevented with the madhushikru leaves practically if it is consumed every day. Datta avapah yatha dosha apakvam hanti vidradhim. So it prevents the suppurative complications as such. Then toya dhanyamla mutraistu peyo api suradibhi yatha doshaganakvatehi pivedvapi shilajitu. Another of the option to prevent all septic complications is shilajitu with either water or dhanyamla etc. But the practical problems with the shilajitu we have referred earlier in vidradhichikitsa I have referred to that issue. Practically the shilajitu which we get now it may not be very effective shilajitu. Then pradhanam gugulum chapi shunthim cha survaraja sneho punaho kuryacha sada chapi anulomanam. Gugulu is another of the very important dravya to prevent any septic complications. Any vidradhi formation can be prevented. Shunthi also or devadaru with the sneha in the form of sneha could be used for prevention. Yathodishtam siramidhet kaphaje vidradho vishaka raktapitta anilo thesho kechit baho vadantiya. Now, Siravyatha is also suggested in Kaphaja Vidradhi. The location of the Kaphaja Vidradhi is a point of dispute even in Sushruta spirit. Somebody would prefer that it should be over the arm, but according to Sushruta, it could be depending upon the location that you have to have the Siravyatha done. Practically, that Siravyatha is very few conditions we do that. Practically, as far as the clinical conditions are concerned, the Kaphaja Vidradhi is almost the cold abscess or granulomatous infection. Typically the granulomatous conditions where it results in a relatively less or indurated condition with the less inflammatory sign. Sharava sadrisha panduhu shitaha sabdho alpavedanaha chirokthana prabhakasya sakanduscha kapotitaha. In such conditions, drainage and curettage is important. See, it's not enough if you drain, it may not be possible to drain completely. So curating the internal surface is necessary. If a simple curating may not be possible, the lesion may have to be excised. Granulomatous conditions, either curating or excision may be necessary. And once you have done that, then the product treatment would be what I would prefer in regular clinical practice would be triple agugulu gandhakarsayana khadirarishta to prevent the recurrence of granulomatous infections. Then the general rule again is same. Pakvam bahirudnam bhitva vranamata श्रुतेषु ऊर्ध्वम् अधो वापि मैरेय आम्लसुरासवैः पेयो वर्मकादिस्तु मधुशिकृद्रुमोऽपि वा शिकृमूलजले सिद्धं ससिद्धात्मकम् उदरं यवकोलकुलत्थानां विषैः भुञ्जीतमानमः प्रातः प्रातश्च सेवेत मात्रया तैलोकं घृतं त्रिवृत्तादिगणक्वाथसिद्धं वापि उपशान्तये. For prevention of all internal visceral abscess conditions, visceral septic pathologies, shikrumula siddham, the shikrumula jala, the kwata prepared with the shikrumula or with the siddharthaka and rice as such, which is to be consumed as a food regularly, can be one of the very effective prevention. Or varnakadigana, madhushikrutruma, same, the madhushikrutruma in any form like shikru leaves or shikru seeds or shikru this mulajala, that's roots also can be used to prevent any septic complications as such. And the other rule is, once it has any of the vidradhi, if it becomes suppurated, it needs to be drained and then you have to treat it as a vrana. Even in case of internal visceral abscess, it has to be drained. Either it gets spontaneously drained or other way. When it gets spontaneously drained, the drainage may traverse the superior compartment, there is the chest, the pleura, which becomes more troublesome. Whereas if it is draining into the peritoneum, it may result in the peritonitis. But important is, in our case of the visceral sepsis, if at all it drains to the exterior by itself, chances of which are lesser, that would be always a better option. If it drains to the upper compartment, that's the pleura and pleural compartment, respiratory complications can occur. If it drains into the peritoneum, peritonitis would occur, which may require a immediate surgical intervention. Otherwise, it can result in serious complications. And this part again we have referred to in case of the Nidanasthana. Prevention is a better in all such conditions. Now, in all vidradhi treatment, the basic approach would be na upagachet eva pakam prayate tadapishaka. All your effort should be to prevent the sepsis. So early stage, if the patient comes at an early stage where the sepsis has not occurred, that can be done. But what happens is most of the times we get the patients at that stage where there is already a separation already. And Paryagate with those siddhi naikantik is that once the pus has occurred, separation has occurred, the final result is unpredictable. Now the same in Vagbhata is mentioned in a different language. The language is very interesting there. Our description is very interesting. Pakancha varayati yatnata siddhi pakvehi deviki apachasu vidahitvaga vidhadisto abhidiyate. Now, but Vagbhata says meaning is same, but the description is it has to be prevented. Sepsis has to be prevented. Once the sepsis has occurred, then the ultimate result is in the hands of the god, Daiviki. And because of the past vidaha, it's called as vidradhi. Pratyakheya kurvita madhyajate tu vidradho. Sneha swedopannanam kuryat raktavasetanam vidradhiktam kriyam kuryat pakveva asthita bedheta nishalyam athapijnaya kartavyam pranashodhanam bhavet tiktakashayena tiktam sarpistradahitam yadi madhyaparishravo nanibartetu dehinaha kuryat samshodhaniyani kashaya adin buddhimana प्रियंगु धातकी रोध कटफलम तिनिसेन्दवम एतैहि तैलम विपक्तव्यम विद्रधि प्रणरोपणम मज्जाजात विद्रधि or osteomyelitis conditions, they present with more serious clinical presentation, and acute osteomyelitis is usually presented with high degree of fever and pain in the area. Chronic osteomyelitis is presented with the sequestrum and the involucrum, the dead bone and the new bone formation with the continuous discharges. Both the conditions may present in two different clinical presentations. Acute osteomyelitis presents with the acute toxic symptoms, and chronic osteomyelitis presents with the persistent discharging sinuses, typical sinuses as such. And in both the conditions, the treatment has to be more effective, more energetic. In case of acute osteomyelitis, the toxemia is the most important condition. So we, in the present day situation, we may have to use antibiotics as such necessarily, and then drainage as per the requirement, and drainage is quite difficult. Effective drainage is difficult. Chronic osteomyelitis is not enough. If you drain, that dead bone has to be removed, sequestrum has to be removed, and whether it can be removed easily or not depends upon the success. Many times the sequestrum cannot be removed, it may be just adhered to the bone. In that condition, you may have to either cure it, or at the most, the ultimate can be amputation. But that's the only choice left over if you want to have the healing as such. And hence, the whole outcome can be unpredictable. Course of the treatment also would be depending upon the presentation of the patient. You cannot just simply say a simple formula, but ultimately success would be depending upon if you can remove the sequestrum completely. That's the in brief. And to treat that, Sushruta has suggested the Tikta Kashaya, Sarpihi Grita with the Tikta Kashaya or Bhavana with the Tikta Kashaya has to be treated. And Samshodhana also has to be done. Repeated Shodhana is other options. In case of chronic osteomyelitis, what I would usually prefer would be Suvarnamalini Vasanta as such. So that's about the usual protocol. Now the last point there is, now in the present day situation, whenever there is a question of abscess drainage, usually it is suggested that the procedure of this drainage is credited to Hilton's formula or Hilton's law of draining the abscess. And that technique is simple. Again, you have to identify an area where the fluctuation is there, and at that area where the fluctuation is maximum, you have to drain the pus and ensure that the pus gets drained completely, and preferably the opening should be at the gravitational dependent area. These are the issues which are discussed in Hilton's law. Whereas what Sushruta has said in Sutrasthana is much better than that. यतो यतो गतिं विद्यात् उत्सङ्गो यत्र यत्र च तत्र द्रवणं क्रियात् यथा दोषो न तिष्ठति. Rather, a better description is required by Sushila, like you have to examine the area, try to locate the area where the fluctuation is more, and then drain out in such a way that there is no further accumulation. So, basic question is whether it is Hilton's method or Sushruta's method which has to be claimed. Sushruta has described that method 5000 years earlier much more effectively, and now the people give credit to Hilton's asset, which is not really a improper asset. Then what Vagbhata has said some more would be Sarvavasthas Sarvasu Gukulum Vidradhishita Kashaihi Yogikehi Sveihi Sveihi Tadvat Shiladitu Pana Bhojana Lepeshu Madhushikul Prayojitaha Ratta Vapahita Dosham Apakvam Hanti Vidradhim. The main three varieties of the drugs which could be used in any form are Gugulu, Shiladitu and Shigul. In case of all septic conditions, these are very practical, absolutely true. With the Shilajits, of course, we have no reservations because it is not really available in the right form. But Gugulu and Shiguru, these are the two important drugs which can be used in any septic conditions practically to prevent. Then one more new development in the area of drainage of an abscess is instead of making an incision, open incision, or instead of having a blind aspiration, now the present day trend is changing to interventional radiology drainage. In the interventional radiology, drainage is one of the most frequently used technique, particularly in internal abscesses like liver abscesses or any other visceral abscess conditions. Instead of making a big opening and opening the peritoneum as such, these percutaneous drainages are now preferred, where the radiology helps in locating the pus as well as guiding the needle into the area so that you will have safe as such. And the basic issue is it is the safest and most direct and shortest percutaneous route is identified with the interventional radiology. Either it could be ultrasound or maybe the CT scan, and it avoids injury to the other vital anatomic structures, and it avoids also contamination of sterile areas, and hence placing a drainage catheter also is possible easily, which can be very effectively placed with the radiology, and hence that intervention radiology has become one of the benchmarks in the drainage procedures, particularly in case of the deep-seated abscess conditions. And the technique is in ultrasonography. The ultrasonography initially locates the pus area, then the axis is decided, and then you put in the needle and then maybe aspirate, then the catheter could be placed in and that can be drained. So that's the latest of the options. With this, we will conclude. Iti Sushruta Samhitayam Chikitsa Sare Vidradhichikitsa Nama Shodasodhyayah. Short chapter, so a bit early. If there are any questions, we'll try to answer, and then there is one question. What will be the treatment for injection abscess? It is exactly the same. It's a Shalyaja Vidradhi. Vidradhi produced due to Shalya. The treatment has to be same protocol. Initially, if the patient comes in the initial stage, LEPA can be definitely applied, and some of the patients of injection abscess may come in the early stages. In that condition, the LEPA can be used, and the treatment protocol will be as in case of the Pittaja Vidradhi. And later on, if the patient comes later, it has to be drained. No other choices, it has to be drained. Right. Then any other questions? Right. Fine then. We will conclude today and continue next class. So,